Hello, I'm Mitchell Johnson. Today I will be showing you some basic anatomy of a sheep heart for my NDSCS Anatomy lab. This sheep heart has been cut in half for more easily viewing of the internal features. Here we have the right atrium, the right ventricle, the left atrium, and the left ventricle. At the bottom of the left ventricle we have the apex, which is the attachment point for the muscles of the left ventricle. Up here we have the base, which is often the widest part of the heart, which is a great place for muscles to attach, and often where blood vessels enter the heart to be pumped back out throughout the body. Between the two ventricles, we have the intraventricular septum, which is a strong muscular wall which aids in the pumping of blood and is very thick due to the pressure needed to pump the blood throughout the whole body. The ventricles are the two lower chambers of the hearts, and the atriums are the upper chambers of the heart. However, these atriums and ventricles cannot be held together without the support of the coronae tendae, which are these fine low strings you can see here easily in the left ventricle. And attaching to the coronae tendae are the papillary muscles, which anchor the tendaes to the valves, which we'll see in the next section. Here you can see the different valves that I've shown with toothpicks that have gone through the different valves into the different chambers. But I'd first like to point out the auricle, which is like the ear-like flaps within the atria. There are muscles. Here we have the bicuspid valve, is often called the mitral valve, and it goes from the left atrium to the left ventricle. Take that one out. The next one we have is a semilunar valve, which is the valve between the aorta and the left ventricle. Right here, you can see how it goes through the skin and comes out. You can kind of see a little green tip there, and that goes and often will lead to the pulmonary trunk or ventricle. Here, we have the tricuspid valve. This one's a little harder to see, but it goes through from the right atrium going into the right ventricle. It is also important that these valves connect to veins and arteries. Arteries are blood vessels that carry blood away from the heart, and veins are vessels that carry blood to the heart. And with the combination of the blood vessels and veins and the pores and chambers, we're able to pump blood throughout the heart. However, there is still some very important anatomical features that make this possible. Here again, you can see the different chambers, valves that have been marked with toothpicks that lead into different arteries and veins. First, we have the aport, which is the large artery coming from the left ventricle. It fills blood, or it supplies blood to the systemic circuit for the body to use. Next, we have the brachiocephalic trunk. It comes from the right subclavian artery and goes out to the right side of the body to fuel the upper body part of the body. Up here, we have the superior vena cava and the inferior vena cava. The superior fuels the heart, or the upper body of the heart, and the inferior supplies the lower portion of the body. And I would also like to point out within the ventricles, there are the trabecular carinae, which are the different folds and